My name is Dr. Nicholas Ayoade. I am a general dentist, and I've been practicing 6 years now. It's actually a childhood story of mine. I've been wanting to be a dentist since I was 8 years old. I had a really good experience with a pediatric dentist. I went in there scared and afraid, and by the end of the appointment, I was eating out of the palm of his hand. I was holding my mom's hand walking outside of the door, and I was like, Mom, I want to do that. And she's like, do what? I was like, I want to be a dentist. You know, the actual procedures, but the way you can change people's perspective and, their whole outlook on their health and life. I've really liked the atmosphere here. It was a patient-centered atmosphere, as well as providing the best quality possible. I've seen a lot of different dental clinics, and I think the difference is the attention to detail, the materials we use, patient information education is just top of the line. I think being in an environment that fosters this kind of excellence just makes me want to do better dentistry. I'm kind of well-versed in everything. I call myself like a joker. Personally, I love extractions. I like the finality of everything, and I also like the ability to just see the body and how it heals. That healing process is always a wonder. And I'm also just looking forward to placing implants and not just removing teeth, but restoring what was lost. I guess one comes to mind is an extraction case, of course. She walked in right before the lunch hour. She was gonna be seen at 1 o'clock, and she was holding her face. Something just wasn't right. She was on the verge of tears, and I'm like, something's not right. I come back from lunch a little early, and then I see her, and she's double on the floor, in pain, crying. We need to get her back to the room ASAP. We get her numb, she can think straight. She finally stops crying. We go in, take care of the broken tooth. She's feeling a lot better. I see her for 1 week follow-up, and she's like, oh my God, thank you so much, doctor. This pain is completely gone. I feel like a new person. You were so gentle, you were so thoughtful. So I think anytime that I can treat somebody and their whole family comes back, I can continue to, care of everyone in their immediate family and their lives. I think that's always a success for me. Brushing with an electric toothbrush or some kind of motorized toothbrush is always best. Please floss, guys. The reason I still have a job today is because people do not floss. I would just say be intentional with how you eat, diet. The habits you create on a daily basis will affect not just your oral health, but your overall health. That charcoal fixes everything. It does not. It's quite abrasive. Not all treatment is painful. There are plenty of treatments that don't require anesthesia. There are plenty of treatments that can be done fairly quickly. Constantly growing educationally, expanding my procedure base with our implants. My goals are to lead a team in an office in the future, be a partner with URBN, provide successful dental care with our patients, and be a staple in whatever community that I'm in, providing excellent patient care, excellent service to everyone. My contribution, I feel like I provide just a sense of education, a sense of calmness, relaxation amongst our patients. Like I said, we already have top of the line equipment and quality here to be able to implement that for all of our patients. And I think with my skill set, I'll be able to do that and maximize each opportunity for every patient experience to the fullest.
URBN Dental, where a team of happy individuals is devoted to creating happy smiles. Book your appointment online today at urbndental.com. That's URBNdental.com.